What if I told you that something most people over 60 dismiss as a minor annoyance, waking up with a dry, sticky mouth, is actually one of the most serious warning signs your body can send you? Not a sign of getting older, not something to shrug off and move on from. A genuine alarm, one that, if ignored long enough, can lead to pneumonia, dangerous infections, and irreversible damage to your heart and brain. I know what you're thinking. Dry mouth? That's my big problem? I have blood pressure to worry about, joints that ache, a doctor who keeps adjusting my medications. A dry mouth feels like the least of my concerns. But stay with me, because what I'm about to share changed how some of my most proactive patients think about their health entirely. And it might do the same for you. The patients who sit across from me in my office are not careless people. They take their medications faithfully. They show up to every appointment. They cut back on salt, gave up foods they loved, started walking every morning even when it hurt. They are doing everything right. And yet, every single one of them, when I asked about dry mouth that night, said the same thing. Yes, actually, every morning. I just thought that was normal. It is not normal. It is not harmless. And the fact that so many people in their 60s and 70s accept it without question is exactly why I decided to make this video. I'm Dr. Jake Taylor, and I specialize in health and longevity for people over 60. What I'm going to share today isn't meant to frighten you. It's meant to give you the information you deserve, the kind that helps you protect yourself before a small problem becomes a serious one. I'll explain exactly what's happening in your body, who and what is responsible for it, and what you can do starting today to reverse the damage. Write your country in the comments below. And if you're new here, subscribe and turn on notifications. I make these videos every week for people just like you, and I don't want you to miss what's coming next. Let me tell you about Barbara. She was 72 when she first came to see me, referred by her cardiologist after a routine checkup. Her heart was stable, her blood pressure was managed, her cholesterol was under control. On paper, she was doing well. But when I sat down with her and asked how she felt, the answer was different. Exhausted, she said. My mouth feels terrible every morning. Dry, like I've been breathing sand all night. And my breath, I'm embarrassed to even talk to my grandchildren up close anymore. She'd mentioned it to 2 different doctors over the past 3 years. Both had nodded and moved on. One suggested she drink more water. The other said it was a common side effect of her blood pressure medication and there wasn't much to be done. So she accepted it. She bought mints. She kept water on her nightstand. She stopped eating certain foods she loved because chewing had become genuinely uncomfortable. She quietly started sitting farther away from people. What nobody had told Barbara was what was happening inside her mouth while she slept, what those dry conditions were allowing to grow, and where those bacteria were going from there. By the end of our conversation, she understood something she hadn't before. Her dry mouth wasn't a footnote in her health story. It was a chapter that needed immediate attention. Today, I'm going to explain exactly what I explained to her and what you can do about it. Why saliva is more important than you think. Before we talk about the dangers, we need to talk about what's actually being lost when your mouth dries out at night, because most people have no idea how much work saliva is doing every single hour. We tend to think of saliva as just moisture, just the wet stuff in your mouth that helps you swallow. But that description doesn't come close to capturing what it actually is. Saliva is a sophisticated biological fluid packed with enzymes, antibodies, proteins, and minerals. It performs multiple critical functions simultaneously, every minute of every day, most of them invisible to you. First, saliva is your mouth's immune system. It contains compounds that actively fight bacteria, viruses, and fungi. Every time you swallow, you're sending a wave of this protective fluid through your throat and into your stomach, where any pathogens it's carrying get destroyed by stomach acid. Without enough saliva, that continuous cleansing cycle stops. Bacteria don't get cleared away. They stay, they multiply, and they cause serious problems. Second, saliva begins digestion before food even reaches your stomach. It contains enzymes like amylase that start breaking down carbohydrates the moment food enters your mouth. When saliva production drops, your digestive system starts every meal already behind. For people over 60, whose nutrient absorption is already less efficient than it was at 40, this matters more than most realize. Third, and most relevant to what happens at night, saliva is the lubricant that makes swallowing safe. It coats food particles, helping them bind together into a smooth, cohesive mass that moves easily down your throat. Without it, swallowing becomes mechanical and imprecise. Particles that should travel cleanly into your esophagus go elsewhere, and that elsewhere is the problem. Finally, saliva constantly bathes your teeth in calcium and phosphate, repairing microscopic damage from the acids in food and drink. A dry mouth is a mouth that cannot heal itself. The medical term for this condition is xerostomia. It's not a sensation. It's a measurable, documented reduction in saliva production. And when it happens consistently at night, when you're already hours away from your last sip of water and your production drops naturally during sleep, your mouth becomes something very different from the protected environment it's supposed to be. Margaret was 69 when we first spoke about this. She'd been diabetic for 11 years and managed it carefully, but her mornings were rough. "My mouth feels like cardboard," she told me. "I wake up and my tongue sticks to the roof of my mouth. I drink water immediately, but it takes an hour before I feel normal." When I explained what was happening in her mouth during those hours, the bacteria multiplying in the absence of saliva, the inflammation building in her gums, the risk accumulating with every dry night, she went quiet for a moment. Then she said, "Why has no one ever explained this to me before?" That's a question I hear more often than I'd like. What's causing your dry mouth at night? Most people assume dry mouth is simply a consequence of aging. The body slows down, produces less of everything, and saliva is no different. But that explanation is incomplete, and it lets the real causes off the hook. Yes, saliva production does decrease somewhat with age, but the dramatic dry mouth that wakes people up, leaves their tongue stuck to the roof of their mouth, and lingers uncomfortably into the morning, that level of dryness almost always has specific, identifiable causes, and many of them can be addressed. The first and most common cause, especially in people over 60, is medication. There are more than 500 medications that list dry mouth as a side effect. And the problem compounds because most people in their 60s and 70s aren't taking one medication. They're taking 5, 8, sometimes 12, each one contributing a small reduction in saliva production. Together, they can reduce output dramatically. The most common culprits include blood pressure medications, particularly diuretics and ACE inhibitors, antihistamines, which are widely used for allergies and also found in many over-the-counter sleep aids, antidepressants, including both older tricyclics and newer SSRIs, bladder medications for overactive bladder, and various pain medications, including certain nerve pain drugs. These medications are often necessary and shouldn't be stopped without medical guidance. But the dry mouth they cause is real, significant, and worth discussing with your doctor. There are sometimes alternatives. Sometimes a timing adjustment helps. Sometimes a different formulation of the same drug causes less dryness. The point is that accepting it silently as inevitable is not your only option. The second major cause is mouth breathing during sleep. When you breathe through your nose, the air is warmed and humidified before it reaches your airways. When you breathe through your mouth, the opposite happens. Dry air flows continuously across wet surfaces for 7 or 8 hours. The limited saliva your glands produce overnight evaporates almost immediately. Mouth breathing during sleep is often caused by nasal congestion, a deviated septum, or sleep apnea. Sleep apnea is particularly important to mention because it's significantly underdiagnosed in people over 60 and carries its own serious health risks beyond dry mouth. If you snore, wake feeling unrefreshed, or your partner has noticed you stopping breathing briefly during sleep, these are reasons to speak with your doctor. The third cause is underlying health conditions. Diabetes is the most significant. Chronically elevated blood sugar affects saliva glands directly, reducing their output. It also raises the glucose concentration in the saliva that is produced, essentially feeding the bacteria in your mouth. For diabetics, dry mouth isn't just a side effect, it's a signal that blood sugar control needs attention. Autoimmune conditions, particularly Sjogren's syndrome, directly attack the glands that produce moisture, including salivary glands and tear ducts. It's more common than most people realize, particularly in women over 50, and often goes undiagnosed for years. The fourth cause is dehydration. This one sounds obvious, but it's more complicated than it appears. The thirst mechanism becomes less reliable with age. Research has shown that older adults often reach meaningful levels of dehydration without feeling thirsty. If you're not intentionally drinking enough water throughout the day, you may be chronically mildly dehydrated, and your body will not waste what little fluid it has on saliva production. The real dangers of ignoring it. This is the section where we need to be direct, because the gap between what most people think dry mouth costs them and what it actually costs them is significant. The first danger is aspiration pneumonia. This is a lung infection that occurs when food particles, liquids, or bacteria from the mouth are accidentally inhaled rather than swallowed cleanly. And dry mouth is one of the clearest risk factors for it. Here's why. Saliva helps food particles bind together and move smoothly down the esophagus when you swallow. Without it, particles are loose and imprecise. Small amounts of food or bacteria-laden saliva can enter the airway instead of the digestive tract. In a young person with strong reflexes, a cough expels it immediately. In a person over 65 with slower reflexes, weaker respiratory muscles, and an immune system that responds less aggressively, those particles settle in the lungs. The infection that follows can be severe. Aspiration pneumonia is one of the leading causes of hospitalization and death in adults over 65, and one of its quietest precursors is the dry mouth someone mentioned to their doctor twice and was told wasn't a big concern. Robert was 74 when his daughter brought him to see me following a hospitalization for pneumonia. He'd been healthy otherwise, no respiratory history, but he had severe dry mouth from a combination of medications, and swallowing had become subtly difficult. He hadn't connected the two. His previous doctors hadn't either. After that hospitalization, we addressed the dry mouth aggressively, changed one medication, added specific interventions, monitored carefully. He hasn't been hospitalized since. The second danger operates more slowly but just as seriously. A dry mouth is a breeding ground for the bacteria that cause tooth decay and gum disease. Without saliva to clear and neutralize them, these bacteria thrive. They attack the roots of teeth, which are more exposed in older adults as gums naturally recede. They inflame gum tissue, creating pockets where infection deepens and bone supporting the teeth erodes. This matters far beyond your mouth. Research has established clear connections between chronic gum disease and cardiovascular disease, stroke, and cognitive decline. The bacteria responsible for gum disease have been found in arterial plaque and in the brains of Alzheimer's patients. When bleeding gums create an open pathway into the bloodstream, those bacteria travel. The mouth is not isolated from the rest of the body. What happens there happens everywhere. The third danger is nutritional and social. When chewing becomes painful or difficult, people change what they eat. They avoid meat, raw vegetables, and firm fruits, the most nutrient-dense foods available, in favor of soft, often processed alternatives. Over time, this contributes to protein deficiency, vitamin deficiencies, muscle loss, and weakened immunity. A cycle that accelerates the physical decline people over 60 are already working hard to prevent, and the social dimension is real. Persistent bad breath from bacterial overgrowth causes people to withdraw. They speak less. They sit farther away. They decline invitations. They miss the connection and engagement that are themselves protective factors for longevity. Something as seemingly small as a dry mouth can quietly shrink a person's world. The plan, what you can do. Starting today, now that you understand what's at stake, let's talk about what actually works. This isn't a complicated protocol, but it requires consistency, and it requires treating this seriously rather than casually. The first and most fundamental step is hydration done correctly, not drinking a large amount of water once or twice a day, drinking small amounts consistently throughout the day. Your body can only absorb water gradually. Flooding your system at once sends most of it straight to your kidneys without hydrating your tissues or supporting saliva production. Set a reminder on your phone every 45 minutes to take a few sips of water. Keep water visible on your desk, your kitchen counter, your nightstand. Make it impossible to forget. Aim for pale yellow urine as your daily indicator. Clear means you're overhydrated. Dark yellow means you're behind. Pale yellow is the target. The second step is fixing your nighttime environment. A humidifier in your bedroom is one of the most effective and underused interventions for nighttime dry mouth. Running one while you sleep raises the humidity in the air you're breathing, reducing the rate at which moisture evaporates from your mouth and throat. Many patients notice a meaningful difference within the first week. If mouth breathing is part of the problem, nasal strips can help mild congestion. If sleep apnea is suspected, a sleep study is worth pursuing. The dry mouth it causes is far from its only consequence. The third step is upgrading your oral hygiene specifically for a dry mouth situation. Brush after every meal using a soft bristled brush and fluoride toothpaste. The fluoride is critical when saliva's natural protection is reduced. Clean your tongue every morning with a tongue scraper. Bacteria accumulate heavily on the tongue surface overnight and are the primary source of dry mouth, bad breath. Use an alcohol-free mouthwash. Products containing alcohol dry the mouth further. Biotin and similar formulas are far more appropriate. Warm salt water rinses, half a teaspoon in a cup of warm water, also reduce bacteria and soothe inflamed gum tissue. The fourth step is stimulating your salivary glands throughout the day. Sugar-free gum and candies containing xylitol are your best tools. Xylitol is a natural sweetener bacteria cannot metabolize, so it stimulates saliva without feeding decay-causing organisms. Firm, fibrous foods like apple slices or celery have the same effect. Include these deliberately rather than defaulting entirely to soft foods. The fifth step is reviewing your medications with your doctor. Bring a complete list of everything you take, prescriptions and over-the-counter products both, and ask directly whether dry mouth is a known side effect of any of them. Ask whether there are alternatives. Ask whether timing adjustments might help. Some medications are more drying when taken at night. Moving them to morning, if medically appropriate, can make a real difference. This conversation is worth having. Your doctor may not raise it. You may need to. That's perfectly acceptable. You are your own best advocate. The sixth step is adding magnesium before bed. Most adults over 60 are deficient in it, and that deficiency quietly undermines dozens of processes your body depends on. Taking 200 milligrams of magnesium glycinate or citrate about an hour before sleep supports deeper rest, reduces overnight muscle tension, and has been associated with more stable overnight hydration. Discuss dosage with your doctor, particularly if you take medications that interact with magnesium. Your 14-day challenge starts now. Let me tell you about Dorothy. She was 76 when I met her, and she came in accompanied by her daughter, who was the one who'd pushed for the appointment. Dorothy herself wasn't overly concerned. "I've had a dry mouth for years," she said. "I figured it was just part of getting older. I manage." But her daughter described what she'd observed. Her mother had stopped eating at family dinners, picking at food instead of eating properly. She'd declined invitations. She'd started sitting at the end of the table, away from others. Her smile was different, more guarded, less open. She was disappearing, slowly and quietly, from the life she used to inhabit fully. When we ran through Dorothy's health history and medications, the picture came into focus quickly. 3 medications with documented dry mouth as a side effect, untreated mild sleep apnea, fluid intake that averaged barely 4 glasses a day. Her mouth was working against her at every level, and it had been for years. We made changes. We worked with her prescribing physician to adjust 2 of her medications. We got her fitted with a CPAP machine which changed her sleep immediately. We built a hydration habit, a humidifier in her bedroom, an alcohol-free oral rinse, xylitol gum after meals. 6 weeks later, her daughter sent me a message. Her mother had been to 2 family dinners. She'd eaten full meals. She'd laughed loudly at the table. "She's back," the message said. "Whatever you did, she's back." Dorothy's story isn't unusual. It's representative of what happens when a problem that feels small is finally taken seriously. And it's a reminder that the years after 60 don't have to be a slow subtraction. When you pay attention to what your body is telling you and act on it, you protect not just your physical health, but your quality of life. So here is my challenge to you. For the next 14 days, commit to 4 things. Drink water consistently throughout the day, not just when you're thirsty. Run a humidifier in your bedroom at night. Use alcohol-free oral care products. And make an appointment with your dentist to discuss what's happening in your mouth. That's it. 4 things, 2 weeks. Track how you feel each morning. Notice whether your mouth is different when you wake up. Pay attention to your energy, your comfort while eating, your confidence in conversation. And leave a comment telling me one thing from this video that surprised you, or tell me what you've been doing that you now realize might be making the problem worse. Your comment might be exactly what someone else needs to hear to take this seriously. If this video helped you see dry mouth differently, share it with someone who needs to hear it. A parent, a sibling, a friend who mentions it in passing and waves it off. Sometimes a single piece of information, taken seriously at the right moment, changes everything. Subscribe if you haven't already. I make these videos every week because I believe that people over 60 deserve accurate, complete information about their health, not reassurance that everything is fine. The truth clearly explained with a real plan to act on. I'm Dr. Jake Taylor. Take care of yourself, and I'll see you in the next video.